So lots of our patients ask us about TENS machines, whether they might be of assistance in their situations. So let's go through exactly what is a TENS machine, when it can be used, how you should set up your machine to get good pain relief. Explaining TENS machines. Is this pain relief or a placebo? Hey, I'm Shelley from Miami and Lakeland's Physiotherapy, and today I'm going to give you the answer to whether TENS can be effectively used for pain relief. TENS stands for Transcutaneous Electronic Nerve Stimulation. Now, if you do an internet search, you'll come up with heaps of different types of units that will provide different types of sensory nerve stimulation. Now, when we're using TENS machines medically, we're talking about a certain type of electrical current set at specific frequencies that have been researched and medically proven. So not all TENS machines you find on the internet are equal. It really is best to buy from a medical centre or your physiotherapy clinic. So do they work? Yes. So TENS has been scientifically proven to provide pain relief in research studies. So TENS machines work through two different mechanisms. The pain gating mechanism, by stimulating the body's production of natural painkillers, the endogenous opioid system. Two different systems. The first one, the pain gating system, works by inhibiting the pain messages. So a simple explanation, if you think of your nerves as a one-way street, by stimulating the nerve with the tingling sensation you get from a TENS, this keeps the nerves busy and it then can't pass on the pain message to the brain. So the best way to use your TENS machine like this is on a high frequency setting, so 90 to 130 Hertz. Now, the endogenous opioid system is stimulated by different nerves, and it then activates natural body's painkillers, the opioids, within the spinal cord, providing you pain relief. If you want to use your TENS machine this way, you use it on a low frequency of 2 to 5 Hertz. Now, there is an alternative approach using the burst setting on your TENS machine. So by setting the machine to the higher frequency of 90 to 130 Hertz, but then bursting at a lower frequency, you can stimulate both the pain gating and the endogenous pain opioid system at the same time. So we find this works well for a lot of our patients. Now, everybody's bodies are different and respond differently in a different range of frequencies. So these settings I've suggested are a guide, but if you're using a TENS, it's best to try different frequencies and find out what works best for your body. Now, when would you use a TENS? Now, if you have pain and you want to try relieving the pain with an approach that's not pharmaceutical based, or if your medically prescribed painkillers aren't quite covering your pain. Often we prescribe TENS as a pain management tool to enable you to complete movements or exercises and give you a way to get relief after aggravating activities. Are there times when TENS is contraindicated and you shouldn't use it? Yes. If you're unable to understand or follow the instructions of your physiotherapist, if you've got a pacemaker, during pregnancy, although we do use TENS during active labour for pain relief, you shouldn't use it over the front of the neck, and patients who have an allergic reaction to the electrodes or a dermatitis or eczema shouldn't use it either. Now, there's also some precautions to treatment with TENS, so please consult your physiotherapy for an assessment of whether TENS would help in your situation and how to correctly set up your machine. So to book an appointment with one of our physiotherapists, give us a call or book through our online website.